And today we are welcoming Cindy Piotrowski, who is the director of the Aging Disability Resource Center here in Portage County. And as we continue our conversation of diversity, equity, and inclusion, we want to be thinking about all of the various agencies and organizations that are available to our population. And Cindy's going to talk about some specific individuals that are often left out of the conversation. So Cindy, I'm going to ask you first if you give us just a little bit of background about who you are, how you became the director of the center, and a little bit about what you do, and then I'll just let you go right ahead with your presentation.
Sure. As Susan had said, my name is Cindy Piotrowski, and I have been the director of the ADRC of Portage County since August of 2013, so almost 8 years now. So it's been a while. And before that, I was the assistant director here. Prior to working for the county at the ADRC, I was the executive director of the Epilepsy Foundation of Central and Northeast Wisconsin. And prior to that, I had worked at both CAP Services and St. Vincent de Paul. So I have some experience in working with low income and a great deal of experience working in the disability community and now with aging as well. So I've got a little bit of a diverse background, but it works, and it worked to get me to where I am now as a county department head, working with both the disability and seniors.
What a great background.
So and I went to school at UWSP, I should mention as well.
We always like to highlight our alums.
Yes. So my presentation is called On the Street Where You Live, and we're going to talk about diversity, not just in terms of the racial or ethnic diversities or bringing in LGBTQ communities, but the disability community in particular, aging as well, because aging is also often fraught with disabilities. So I'll be talking about both of those groups, but to remember that diversity includes people who are differently abled and people who are older as we go forward. So we look at let's see, who are seniors and adults with disabilities? Where are we going to find them? What protections are there for these communities? What are some of the areas of disparity that we know exist for them? And let's talk about community conversations. How do we talk about the elderly? How do we talk about adults with disabilities? So why does it matter? Well, it matters because in 2005, which is 15 years ago already, you can look at the population in the state of Wisconsin for age 65 and older. And the younger counties are in yellow, and then you get to the dark greens and to the blues, right? So this is where what we know we've had for aging in our community. This is what it's projected to look like in 2035. So we know that our communities are aging. And there's a couple of things to remember with that. You know, people live longer. I don't know that I'd say we live healthier, but we certainly live longer. And how we talk about our seniors is a big deal too. National statistics on people with disabilities, 56.7 million people, 70% of adults over 80. And the areas that we look at, and you can find this in census data as well, as hearing, vision, cognition, ambulatory, self-care, and independent living. And these are things that we look at as we enroll people for functional ability into long-term care. So who are the seniors? You know, you think of Granny, and Granny's got glasses and her hair's in a bun. Grandpa's, you know, has no hair. He's, you know, hunched over. So is this who our seniors are? Or is this who our seniors are? You know, out and about, active and walking around our community, doing things. The grandmother one always cracks me up because I am a grandmother. And I'm not quite hunched over yet. And and I don't wear my hair in a bun, almost never anyway. And I don't, you know, sit in a rocker with a shawl on my shoulders. So why is that the image we have for grandmas today? Whereas, you know, there are a lot of other ways to view grandmothers, and some of them could be, you know, working professionals. But these are some of our seniors who did a trip over to the fire station and got a nice tour with some of our local firefighters. So who are people with disabilities? Are they all in wheelchairs? Do you know when you see them? What does that mean when you think about who are the people with disabilities? So are they that, or are they this? These different stars have all come out and acknowledged a disability of some sort, mental health, epilepsy, other issues that people have had. So people don't look different necessarily when they have a disability. So where do the elderly and people with disabilities live? You know, where do we think they live? A lot of people will tell you they live at the county home or they live somewhere else. You know, where people with disabilities and the elderly live, they live everywhere. So this is my street. This is my block in Stevens Point. So this is what it looks like. You know, I have a middle-aged working couple. I have a young family on the ends here. And then I have an empty house because the person moved. Middle-aged couple caregiving for aging parents. Young people with 2 apartments who are working. And an elderly woman who lives independently and is retired. Then I have a couple with no kids who works. Family with college-age children who are low income, middle-aged SSDI recipient, middle-aged chronic health conditions, 1 retired, 1 working, and an elderly couple with frail health who are retired. So we have people with disabilities who live on my block. They're my neighbors. We have caregivers. They're my neighbors. We have people who need care. They're my neighbors. We have people who work. They're my neighbors. So we find people who are disabled or who have who are elderly everywhere in our community. So there's something called the Olmstead Act, which really, you know, if we're going to boil it down to one thing, it's that people do not need to reside in a facility. Olmstead allows them to live in the community, to live full lives and have everyday life activities. And so that's probably, you know, I mean, there's lots of other things. I'm very much oversimplifying this, but if there's one thing you want to remember about Olmstead, it's that they cannot be restricted to living in a state-run facility or a nursing home. And it allows people to be part of their community. Americans with Disabilities Act, the ADA amendments, affordable care, these are all things that have helped people with disabilities and seniors remain in their homes in the community. So people with disabilities can't be discriminated against. The Amendments Act, so initially with the ADA, the Supreme Court had ruled against people who had illnesses like epilepsy, where it is not something that you don't continually have seizures normally, right? You have the occasional seizure that knocks you out. And initially they had excluded people from coverage from the ADA. The ADA was originally authored by Tony Coelho, who was a congressman from California who happens to have epilepsy. And they came back and they wrote an amendment to the ADA to make sure that diseases and health conditions like epilepsy and diabetes were being covered when it's not it's a chronic condition, but you're not in perpetual acute status. So that made a big difference. And then of course the ACA, Affordable Care Act, or Obamacare, as many people refer to it, makes it so that you can't be discriminated against when it comes to getting insurance, which, believe me, having worked for the Epilepsy Foundation back in the 1990s, before there was anything like the ACA, people were discriminated against. You could not get insurance independently if you had a seizure disorder. Consumer protections. So there's some state statutes out there protecting elderly and disabled people. There's civil penalties, enhanced civil penalties if whatever was done to a person with disabilities or an elderly person. Includes pandemic or penalties for pandemic. It's the word on my mind, right? I see a P. Include penalties for physical or emotional damage, and more likely to suffer the loss than other persons due to their age, poor health, impaired understanding, or restricted mobility. So there are some protections for people out there. Consumer violations. Oh my gosh, these are two groups that are hit hard on this. You know, there may be landlord tenant things, mail order scams that come through all the time, deceptive offers of employment where we'll give you a job but you have to pay us, dating services, telemarketing, lots of things that target both seniors and adults with disabilities.
We often refer to these as vulnerable populations. That people perpetrate crime and think they'll get away with it very easily because of that.
Right, and they do get away with it more often than not because those two populations are less likely to report that sort of scam or abuse. And they don't because they're afraid, they're embarrassed, they're worried about calling into question the ability to manage their own money. They're worried about their independence. They're afraid they'll get diagnosed with dementia. They're afraid that they will lose their home or be forced into a nursing home. And by the way, one of the things that we know is that people use the term nursing home a lot to mean more than a traditional nursing home, which is skilled nursing facility. They use that term, but they might mean assisted living or a memory unit, which are not really the same thing. Sort of like calling a tissue a Kleenex. They use it generically, but it's not really a generic term. We know that there are disparities for people who are seniors or who are adults with disabilities. Healthcare, transportation, housing, vocabulary, how we talk about people. Those are some pretty big disparities for those two groups.
And we know that all of those issues, especially healthcare, transportation, and housing, are issues for everybody.
Right. It's just
So to have it
more complicated. Right.
Yeah.
And I can tell you, we just did our aging survey, and the vast majority of seniors in this community who responded want to remain in their own home, whatever their home may be. It could be an apartment, a house, a trailer, they want to remain in their own homes. And so what does that mean, and what does it look like for them to be able to do it? And I can tell you, no matter what it costs for them to be able to do it, it's still a lot less than putting them into an assisted living facility or a nursing home. So healthcare, the number of people with disabilities is expected to increase for this census that we don't have good results for yet, but they're coming soon. And people with disabilities experience difficulties or delays in getting the health care they need. There's a number of reasons for that. Some people don't call when they need to, and others can't articulate what the reason is that they need to be seen. And so when you work with seniors and adults with disabilities, you have to hone your listening skills, because you will get a very rambling story sometimes, in which then you have to be able to pick out one or two nuggets that are the actual issue. Inaccessible medical diagnostic equipment. So if you're in a wheelchair, it's very hard to get an MRI. People have to lift you. You can't just sit down and lay down on the machine, right? Or x-rays. They're the simple things that we don't really even think about too much. And then, of course, the lack of available transportation. We are very, very lucky in the city of Stevens Point that we have public transportation to the extent that we do. They don't have that in Wisconsin Rapids. They don't have it in Marshfield. They don't have it in most cities our size. So we are very fortunate here. We know that the number of people who are aging is growing. There's a shortage of doctors in our state, especially in the rural northern areas of the state. There's a lack of access to transportation, affordability of medical care, and many, many seniors are living on Social Security benefits alone. And there are a fair number of senior women who are living solely on survivor benefits. They never worked, they never earned money themselves, they never contributed to the Social Security system. Their only income is Social Security survivor benefits, and so their total income for a month is less than $500. Factors that affect health: social and economic, physical environment, access to clinical care and quality care, and then healthy behaviors, of course, is a big piece of our healthcare.
Isn't it interesting? I just have to comment on that slide, Cindy, that the healthy behaviors is 30% is attributed to that. And when most people talk about health and well-being, that's their primary focus. And we kind of forget about all those other things that really do impact.
Yeah, 40% is social and economic factors.
Right.
You know, feeling like you can pay for your trip to the doctor, even when you're on Medicare or Medicare and Medicaid being a dual eligible. People worry about that. They worry about being able to pay for going to the doctor, or the medication they may need, or the time off they may need, because we have working seniors. The fastest growing employment group in our state prior to the pandemic were people 75 and older, because they needed the additional income. So we can look at, you know, different things that affect people, and this breaks down what we had been talking about before, so that you have a length of life and a quality of life, right? Those are two pieces of your health outcomes. And so there's policies and programs, there's health factors, and then you have these outcomes. And so healthy behaviors are tobacco use, diet and exercise, alcohol and drugs, sexual activity. People laugh a lot when they talk about that with seniors, but let me tell you, it's an issue. There have been facilities in our community that have had, you know, outbreaks of sexually transmitted diseases. And it brings a lot of people laugh. And so I like to share this, especially with younger students. So when the old people sex, and so my response, because I had one of my family members do that one day, and I said, well, you tell me, at what age do you plan to stop having sex? Oh, gives it a whole different perspective. At what age do you plan to stop? And people have a right to have sex, whether they're married or not, in a nursing home. So we put a lot of rules around sex for older people that we don't put around younger people, that don't apply. And by the way, these older people, they leave you in the dust. By the way, this is the Woodstock generation here are now all nursing home eligible ages. So
I appreciate that you bring that up. Actually, I also teach a human sexuality course, and it's so important that it doesn't just stop. You turn 50 and all of a sudden you're no longer a sexual being.
Right.
So I think that it is important, and the comment
I highly
about the STIs increasing in that population, because we tend to think of birth control to, and they're not worried about getting pregnant anymore. So that's not a problem. And sometimes they think about the other things that can happen.
Yes. I mean, and we don't think about it. And yet it's one of the things I don't know if you have watched the show, Grace and Frankie. I highly recommend it to anyone. Okay. Not only is it extremely well done, but it addresses some really great issues for seniors. So it just, those are healthy behaviors, right? And then clinical care, social and economic, your education, your employment, your income, your family and social support. We have a big reliance on what we call, family support for providing services for people who need it. And yet not everybody has a family, and not all families are willing to do it. So, we can't assume everybody has someone to take care of them. And then, of course, your physical environment, your housing, transit, air and water quality. We're pretty lucky in Stevens Point. We have some of the best water in the country. So, and yet it's not perfect. Health literacy. This is something that not everyone has heard of, and yet it's very important, because it's not just about what you've been told about your healthcare. It's how well do you actually understand what you're learning, your literacy about the information that you're given. So capacity to obtain, process, and understand health info and services needed. This is a big thing that, we don't teach people how to be literate about their health. Most likely to have lower health literacy, older adults, minorities, where things are not put into plain language or into native languages, people without a high school degree, people with lower income, non-native English speakers, people with compromised health statuses. So if you've always been ill, you may have missed a lot of school, you may or may not be able to understand what all of your health conditions are. So percentage of older adults, this is from 2015, who self-reported that their health is fair or poor. So you have 50 to 54 years and, just under 15%. It gains about 5 percentage points for 55 to 59, just a little bit at the 60 to 64. But when you hit 65 years and older, more than 20% of adults say that their health is fair or poor. So in Wisconsin, our numbers are higher. So in Wisconsin, where it was just under 15% for 50 to 54, we're at 20. Where it was just over 15% at 50 to 59. We're at like 26. We're at 30. It was just over 20% for 65 and older. For the rest of the country, here it's 35, just under 35% report having a disability. So health literacy is going to impact, you know, your preventive screenings. You're more likely to have a chronic condition that's not managed well. You have preventable hospitalizations, more likely to have general poor health and more expensive health costs. Because if all your treatment comes from an emergency room, it's a lot more expensive than having a regular doctor that you visit. Transportation. So things that we know impact transportation are age, income, home ownership, health status, Medicaid participation, and education level. So adults with disabilities are 2 times more likely to have, or adults without a disability are 2 times more likely to have, I can't read that right. 31 versus 13, 2 times more likely to need transportation or adequate transportation. For many people, disabilities, traveling by car is not an option, whether they can afford it or not. If you are in a wheelchair, while there are vehicles that are wheelchair accessible, most wheelchairs are not, and it's not easy to do it on your own. So you almost always would need assistance to do that. Transit affects access to affordable housing. It also affects access to employment for people with disabilities. So 1 in 5 people over 65 do not drive. So once you hit 65, that's 20% right there. Many people with disabilities traveling by car is not an option, which I already said. And when you're in rural areas, wherever you go further, right? It may not take you longer because, you know, going from one side of Milwaukee to the other is going to take you just as long as driving from Almond to Stevens Point, if not longer, but you've traveled a further distance to do it. So they don't drive, so they stay home. It has a tremendous impact on socialization and isolation. We have several programs that help us fund transportation for people. We have 5310, 5311, 8521. These are all numbers for state and federal programs that pay for transportation. And we're lucky enough in Portage County to have these programs. Affordable housing is a huge impact. A number of years ago, there was a candidate for mayor for the mayor of New York City, and he called his party the "Rent is Too Damn High" party, because rent is expensive. Even in a city like Stevens Point, rent is high, and you know, ideally it should be less than 30% of your income in housing, and often it's more than 50% for people who are low income, just to keep a roof over their heads. And we know that there is a lack of affordable housing for seniors outside of the existing housing stock. So there's not a lot of places for them to move to that are affordable if they're lower income. Things that make a difference: cost of repairs. So while it sounds like a lot of money to re-roof somebody's house and make it livable, re-roofing their house is less than 2 months worth of living in an assisted living facility. Costs less. So maybe we need to rethink some of how we do this for housing. vocabulary and conversation. So I'm going to start here. So Susan, you had mentioned ageism earlier. We talk about seniors like they're one big group, like seniors want this, or elderly want this, or elderhood, or however you want to refer to people 65 and older, or 60 and older, or we have programs for 55 and older. You join ARP at 50. So how do we define that, right? So we talk about seniors like they're one big group. We would never talk about 18-year-olds and 48-year-olds like they were in the same place in their lives, right? That 30-year difference, we wouldn't do that because we know they're not in the same place. But we talk about 60-year-olds and 90-year-olds like they are. And I can tell you 60-year-olds more often than not are still in the workplace. They are not in the same place in their lives as a 90-year-old. And there are distinct generations of seniors right now. We have our greatest generation, those World War II veterans and home front people who made things, made the world a better place. And then built a lot in our community, in our country. And they are all in their late 80s or older now. Then we have what's called the silent generation. And these are the folks that were either very young or born during World War II, right? And it's the biggest misnomer ever, because the silent generation is the generation that gives you Janis Joplin. It's the generation that gives you Elvis Presley and the Beatles and the Rolling Stones and so many fantastic musical artists who had a calling and a voice. Now, often they get credited as boomers, but they're not. They're part of the silent generation. Then we have the boomers. And what the boomers do is add numbers. And the boomers were born from 1944 to 1946 to 1964. So it's not quite 20 years. And the youngest boomers are still in the workforce, and they have 8 years to go until they turn 65. And I was born in 1964, so I always pay attention to this. So you have boomers who are seniors and boomers who are not seniors. And you have boomers who are working and boomers who are working much longer than others did, and boomers who retired early. It's just like the rest of the world. It covers all bases, right? But we talk about seniors like they're one group and one place with the same needs. It's no more true of them than it would be for an 18-year-old and a 48-year-old. So everyday ageism, attributing forgetting to our age. People do this all the time. Oh, I'm getting old. I can't remember. What was that word? 90% of marketing dollars target people younger than 50. We hear this where I work a lot. Old people go there. They're not going to go. Old people go there. Benevolent ageism refers to assigning protection or benefits to people because older age is assumed to identify need. So we have to take care of our people. We have to take care of them. We have to provide them with this. And the emphasis on the looming healthcare crisis as the boomers age. As people get old, they need more help. They need more health care, because again, we're aging, but we're not necessarily healthy in aging. And so all this anticipation of cost related to aging. So we move on to what's wrong with this, right? She's 82, but she's really young at heart. My dad is 87, but he still drives. Although my aunt is 90, she's still sharp. He's still working despite being 74. Even though she's 81, she still plays tennis. Still, don't you love that word? You're 83, you don't even look 70. I mean, so we have lots of things that we say to people about their aging. So instead of looking at, the negative and then putting it up, like a positive backhanded compliment, right? Say she's a very happy, joyful woman. My dad loves driving his car to the store. His age doesn't factor into it that way. My aunt, who's 90, is great at crossword puzzles. My dad is 74 and just loves his job. My 81-year-old friend continues to love tennis. Congrats on being 83. You're beautiful. And I've been doing this for 30 years, so perhaps I can provide some institutional history. But these were all examples that came from the Wisconsin Institute for Healthy Aging.
I think one of the best ones there is, instead of saying that someone still is doing something, that they continue. It's so interesting, just that change of terminology and what a difference that really makes.
And making it positive. We actually, pre-pandemic, we had some plans to do some community conversations around ageism and how we talk. And then, of course, with the pandemic, now we'll bring it back up maybe next year, but it's been an interesting pivot, right? So people first language, people with disabilities versus handicapped and disabled. Are people epileptics, or are they people with epilepsy? Are they diabetics, or are they a person with diabetes? People with intellectual and developmental disabilities versus the R word. We don't use that word anymore, retarded. Down's kids, mongoloid. I hadn't heard the word mongoloid, honestly, since I was a kid. People with mental illnesses versus they're mentally ill, emotionally disturbed, insane, crazy, demented, psycho. People who use a wheelchair versus a cripple or wheelchair bound. Mental health words are hard because they have crept into our vocabulary in ways that we don't even realize we're using it. I'm going to do that. That's crazy. Is it crazy, or is it just something you don't want to do? So that's too much work. I don't want to do that. That's too much work versus I don't want to do that. That's crazy. So how are we? What kind of precise language are we using? So change the conversation, eliminating stereotypes where you can. The words we use matter. What do you say about people? And, always, and my children would tell me, when I tell them, is it better to be clever or to be kind? I always say to be kind, and they always tell me it's better to be clever. But we still like the be kind. Maya Angelou once said, people may not remember what you said to them, but they will remember how you made them feel. Kindness doesn't cost a thing. So any questions?
Cindy, it's such great information, and it absolutely reinforces some of the conversations that we've had in class previously. Because sometimes students don't know that much about the Aging Disability Resource Center specifically, could you just share a little bit about some of the programs that you have, or how students might be able to be involved in some of the work going on there?
So we are what's called an integrated aging unit and aging disability resource center. So our aging unit is our traditional aging programs through the Older Americans Act, like nutrition. We have congregate dining sites that are not operating right now because of the pandemic, but will be back this fall. And then we have home delivered meals. We have caregiver support services like the National Family Caregiver Support Program, the Alzheimer's Family Caregiver Support Program. We have a dementia care specialist. We help fund transportation. We partner with the city to do that. We have RSVP, Retired Senior Volunteer Program, and foster grandparents. We also have a senior center and lots of programming, from activities like bunco to knitting and crocheting and square dancing and round dancing and learning French or Polish. So there's a lot of things that we offer as a senior center as well. And we have a lot of evidence-based health programs. So Kate Giblin is our health promotions coordinator, and we have programs like Healthy Living with Diabetes and Living Well with Chronic Conditions and falls prevention programs like Stepping On. Lots of great programs to help people stay healthier and living in the community longer. So students, we are now back to where we have students coming in as interns. So we have intern possibilities. We have an adult day center as part of our programming that provides respite for the caregivers, but also is an opportunity for one-on-one interaction, primarily with people with dementia, but not exclusively for people with dementia. And we have a couple of participants who are now seniors who do have intellectual and developmental disabilities, who have lived to being seniors in our facility. Susan may remember years ago, if a child was born with intellectual disabilities, they were often told they won't live past the age of 12 or 16. And we know that's not the case anymore. So we have opportunities with that. We also do things like, interns for marketing and other programming, but probably the most possibilities are in the senior center and the adult day center. We also have the ADRC component, where we do the functional screening for people with who want to qualify for publicly funded long-term care. So we do that screening and determine if they're functionally eligible. We do something called options counseling, where we help people figure out the best way to spend their own resources. Some people are surprised to find out that our actual goal is to help people stay off of publicly funded long-term care for as long as possible, to spend their own resources wisely, to provide the best care for themselves. So there's a few different things that students can get involved with at our agency. And actually, if you have students who are looking for fall internships, we are now able to do that.
Oh, that's fabulous. I know that we've had some interns in the past. It's been a few years. I haven't been the one supervising the practicums the last few years, but when I did, I had the opportunity to see some of the great things that are happening at the ADRC, and just hearing you talk about the number of programs that you're managing and monitoring with volunteers, with staff, and just the wide variety of clientele that you're serving. Mm-hmm. I think that that's always a big surprise to people. As you said, we wouldn't talk about 18 to 48-year-olds the way that we talk about 60 to 90-year-olds, and mm-hmm. running the gamut with the interests and abilities, for sure.
But I also like to point out that every surviving member of the Grateful Dead is old enough to receive our services.
Well, when you talked about AARP, I've been getting letters from them for 4 years now. So
yeah, as soon as my husband turned 50, we joined. You can get that nice little discount every once in a while. But it's an interesting time to be aging, because baby boomers turn things on its head, right? I mean, I have friends who are in their 60s who are like, well, I'm like, oh, you'd be great, you should come do this with us. And they're like, it's for the old people. And I'm like, no, you're an old person.
It depends on what day it
So,
is, how old I actually feel. Going to
all
Zoom.
right. I mean, and I'm, 57, so I have a ways to go yet. And, um, the boomers aren't all seniors yet.
Well, we're so thankful to have such great opportunities in our community to support individuals and to highlight the needs that are out there because, as you talk about the issues of ageism and ableism and just the significance of transportation and housing and healthcare, that we do need to recognize these as concerns and then do something about them.
Right.
And
So I hope I covered what you were looking for. I
oh,
mean, it was.
absolutely. And I will share your contact information, Cindy, with any student who'd like to reach out with maybe other questions or
Right.
potentially an opportunity to consider an internship or some volunteer opportunities.
Right. And again, it's not that we do not pay attention to things like uh, racial diversity and the LGBTQ community here. We do. But this was an opportunity to really talk about the role of disability and aging and diversity.
Absolutely. I'm so thankful for that. We are really fortunate to have such great leaders in our community, and we've had a number of individuals and have some others, again, to highlight the work that's being done in Portage Wood and Marathon counties right where we live. And again, to help students think about what can they do to keep advancing those initiatives and making our community better for everyone.
Yes.
Thanks so much, Cindy. I hope you have a great rest of your day.
Thanks, you too.
Bye
Bye-bye,
now.
Susan.